We started a series this fall during the quarantine period to have a panel of physicians, each in their own respective specialty, but somehow found their way to sports medicine and are also actively involved in AMSSM. So tonight's presentation will be the sports medicine, emergency medicine world. And tonight we have 5 doctors with us, all in emergency medicine, sports medicine. And I'm just gonna give a couple brief intro to everybody that's here. And then each one will have a chance to kind of tell their story about how their emergency medicine path kind of led to their sports medicine world, and maybe give some more details about how life's changed a little bit during the COVID-19 era. So I'll start with Dr. Den. He's up on the left, top left corner of the screen. Dr. Den is a clinical assistant professor in the Department of Emergency Medicine at the University of Arizona. He's originally from the Bay Area in California, and loves to travel, to visit new cultures, and being around friends and family. Dr. Durkin, just below him on the screen, he's a medical officer for the Indian Health Services Northern Navajo Medical Center. He's a former Gator and former owner of the Durango Sports Medicine. Currently lives in Colorado with his wife and 2 outstanding cats. We'll move just to his left, so middle of the screen, and Dr. Geyer. Dr. Geyer is an assistant professor at Wayne State University School of Medicine. He completed his emergency medicine residency in Detroit, and then he followed that directly with his fellowship in sports medicine. Next to him, we have Dr. Waterbrook. Dr. Waterbrook currently practices both emergency medicine and sports medicine as an assistant team physician for intercollegiate athletics at the University of Arizona. She is active in many national sports and emergency medicine organizations and is currently a member of the AMSSM Board of Directors. And down at the bottom of the screen, certainly not least, Dr. Holsheen. Dr. Holsheen is a board certified in both emergency and sports medicine, has been at several institutions, including University of Chicago, University of Michigan, Loyola University Hospital, and also worked in the private practice. She was a former 4-sport varsity athlete herself growing up in St. Louis, Missouri, and she currently resides in Chicago. So why don't we start with you, Dr. Dunn, kind of give your kind of story, your take into sports medicine and emergency medicine.
All right. Thank you very much. Thanks for having me. So I go by Will. I grew up in the Bay Area, like you said. Don't really travel or hang out with family quite as much these days, but my story did start in the Bay Area, and I went to the University of Pittsburgh for undergrad and med school, then to George Washington University in DC, and then the University of Utah for my sports medicine fellowship. And then Anna Waterbrook actually was able to recruit me over to the University of Arizona, and I'm very thankful for that because it's been a wonderful experience so far. I'm also involved with the US Ski and Snowboard team as well as the Tucson Roadrunners here, and sports medicine is just one of those great outlets, I think, that is a great adjunct to emergency medicine. I think we provide a lot of skills that kind of interlink between the 2 specialties, and so happy to be here and happy to talk more about it.
Very good. Dr. Durkin, would you like to kind of continue?
Yeah, for sure. Thank you. So I finished ER residency and then practiced in the community in Albuquerque, actually, for a number of years. Was super involved with EMS and mountain rescue, and then kind of along the way, just kind of developed an interest in kind of fitness and kind of seeing, I can think of a mission we got called out on with the mountain rescue team where we had this guy who'd been crushed by a boulder and, critically ill trauma patient, and feeling like pretty comfortable with dealing with that. But then we're hiking back, after we put this guy in the helicopter, and one of my friends has anterior knee pain and really not having any frame of reference to how to deal with that. And so that kind of led to sort of this journey that eventually led me going back to fellowship and stuff. So finished fellowship, started working part-time at my current employer, which is the Indian Health Service. So I work in the emergency department on the Navajo reservation. We've been super hard hit with COVID. And so, and then while doing that was also starting my own private practice for sports medicine, which didn't make it. COVID hit, and it just, trying to, deal with the COVID issues at the hospital and, you know, sports being basically outlawed at the start of the pandemic. That was sort of all she wrote for my private practice. So I had to close that down. So, you know, for the learners out there, for the residents, the students, you know, your career is probably not going to be this like perfect, you know, unicorn rainbow, wonderful experience. And that's okay. Like, you know, one door is going to open and then another will close. And, you know, that's just kind of how life rolls. So don't feel like it's all going to be perfect or it has to be. But about the time that right before COVID kicked off, I actually got approval from IHS to start a sports clinic actually at the IHS hospital. So if and when we ever get back to normal clinic operations, then that'll be a new service to offer in our district with the IHS. So and there's a huge need. So really excited about that. Still pretty involved with some EMS and mountain rescue stuff, and yeah, just kind of try to do different things and keep it interesting. So yeah.
Very cool. Thank you very much, Dr. Durkin. Dr. Geyer, would you like to give a little bit more explanation of your intro?
Yeah, thanks so much for having me on the call tonight. It's great to collaborate with everyone and to kind of spread the specialty of emergency medicine and sports medicine. I just passed the decade mark. I just took my concert exam last weekend, so that's for students on the call. That's our board recertification exam. So I know what you're going through with all the exams lately, and feeling that stress, especially trying to study during COVID. But I've been at a split practice in Detroit, working at a big academic program where we have 3 sports medicine fellows a year. So I worked as one of the faculty members in our fellowship program, as well as in our residency, where we have a pretty big categorical residency program with a lot of the subspecialties represented. So it's been a lot of fun to work with a diverse group of physicians. And, you know, I'm always learning new things every day, which is, you know, why I love working where I work. And I also really enjoy collaborating with a lot of you on the call here today. So there's so many great physicians that we're doing a lot of good work with. In my clinical practice, I split time between the emergency department, working shifts clinically, seeing patients in the sports medicine clinic in the outpatient setting, doing concussion management, as well as a lot of ultrasound guided procedures, fracture management, splinting, bracing, doing some work with teams like the Detroit Lions. That's our NFL team here in Detroit, as well as U.S. Ski and Snowboard, along with Will and some of the others on the call. I also have a pretty big role at the School of Medicine, where I'm the director of clinical skills. So that accounts for about 40% of my time, where I'm teaching at the medical school, running a pretty big course. We have 300 learners a year in the course for the largest single campus medical school in the country. So we have a pretty big program there. So just being involved with medical education and research. I'm hoping to shift gears here next year to actually return to school for a master in health professions education program.
Thank you very much. And Dr. Waterbrook, would you like to explain more of your introduction, please? Could you unmute?
Got it. Thank you. You know, all these Zoom issues that come up. Anyway, I've got 4 small kids, so you never know when they're gonna scream or cry in the background. So I feel like I have to be muted all of the time. Anyway, yeah, thanks so much for having us. I think, you know, so I'm at the U of A. I wear many hats. Like my intro said, I'm clinically active in both specialties, which, you know, is really cool. And but you know, when I did not know that I wanted to do sports medicine my whole life. I was an ER resident, and I sort of knew I wanted to do a fellowship and wasn't really sure what I wanted to do. I thought about pediatrics. I thought about wilderness medicine. I thought about international medicine. But one of my mentors, you know, had said to me one day that I'll always remember. He's like, you know, just figure out something that you like to do when you are not at work and find a way to make that a part of your career. And it can be through formal fellowship training. It can be sort of your side gig in the emergency department, but try to find a way to have those two overlap. And I mean, I I have never been an athlete, although a lot of people who are former athletes are naturally drawn to this field. But before kids, my husband and I spent most of our free time hiking and biking and doing triathlons, etc. I saw the sports medicine doctor at my residency quite frequently. And it sort of occurred to me that that was what I really enjoyed doing outside of medicine. And I'd covered some marathons and done some dabbling. But it ended up, and that's kind of how I ended up falling into a sports medicine fellowship. And it's been super cool and probably one of the best decisions that I've made. I feel like it's a really nice balance, quite honestly. I don't think that I could do primary care sports medicine Monday through Friday, but I also don't think I could do emergency medicine 16 or 17 shifts a month. I think the balance is really great. And I did not have the foresight to realize that back when I was choosing this. But I think it's a super cool field. And the nice thing is that it's one of the few fellowships and subspecialty training in emergency medicine that you actually can truly be dual board certified and have 2 practices of medicine. And, kind of like Dr. Durkin was talking about, I mean, you may not have your dream job right out of training, but you have so much flexibility with having 2 subspecialties. I mean, you might do primary emergency medicine at some point and primary sports medicine, and then do both and you can kind of go back and forth. And so it just creates a lot of flexibility, and you can, really do some pretty cool things. The other things that I found that's really cool about what we do is that we're really a very small, close-knit group being sports medicine, emergency medicine trained. So in the emergency medicine world, we're a small group. And conversely, in the sports medicine world, we're also a small group. And so you sort of get to be experts in your field almost the minute you finish your training. Like Chris Geyer and Jolie Holschen and I mean, I feel like we're kind of almost one of like the oldies but goodies, because we've been, working together at the national level through AMSSM and ASAP and SAM for, 10 plus years. Sorry, guys, I'm giving our ages away. But it's also super cool because you really have this collaborative group of, you sort of have a collaborative group of people nationally, and you get to see them and collaborate throughout your career. So anyway, I feel like I'm going off on a little bit of a tangent, but hopefully I answered your question.
No, great. It was great. And Dr. Holsheen, would you kind of like to wrap up with the introductions?
Sure. I guess, first of all, thank you for having me on the panel. Similar to what Anna said, I think I've worn all these different hats at different parts of my career. You guys make me feel old because now I'm looking at my 2nd board recertification. I'm coming up on 20 years soon. I guess I'll first speak to how I decided to go into sports medicine and then emergency medicine. I always, growing up, I always considered myself a jock. And so when I was in high school, really looking at careers, I thought that medicine would be interesting. I was really involved in science, but then I actually had my own injury. And the surgeon was a friend of my father's who covered my dad was a football coach. And so the surgeon worked at Barnes Hospital in St. Louis, Dr. Shively, and he let me stay awake and watch my own knee surgery. And I thought it was the coolest thing ever. And so I kind of at that point had made up my mind that I would go into orthopedic surgery. And so I ended up applying to combine undergrad medical school programs and got into a program at WashU called SPIM, where I had a spot in medical school when I finished my undergraduate degree. And while in medical school, I really didn't seriously consider emergency medicine until my 4th year. I kind of struggled with, do I want an operative career or non-operative career? I really loved sports medicine, but I got a little bored with the fact that the majority were subspecialized in a particular niche and operated on the same joint, the same surgeries over and over and over. And I found out during the late summer of my 4th year that you could go into sports medicine after emergency medicine. And I never knew that before. I always had heard through family medicine or the surgical route through ortho. And around that time, I had done all of my sub-Is in ortho and realized that some things there weren't for me, even though I loved being in the operating room. And so then I did another rotation in emergency medicine and made the decision at that point to not proceed further pursuing orthopedic surgery, and went into emergency medicine, knowing that, you know, up front at the beginning that I wanted to do the sports fellowship. But while in emergency medicine residency, you know, there really were very few mentors around to kind of guide you how to get into a fellowship or to provide you with some opportunities to build your resume. I mean, I think when I finished my fellowship training, there was only about 40 emergency medicine physicians board certified in sports medicine at the time. And so during the years that I was coming through, even fewer. But you know, I did hook up with some physicians who provided some moral support as well as a few opportunities to build my resume. And I did get into a fellowship program at the University of South Carolina. I really felt like the emergency medicine side provided me with a great skill set in terms of procedures and responding to emergencies on the field that many others from other specialties maybe didn't quite have that in their back pocket. And, you know, I also had done some cool things with being a flight physician. So there was, during residency, so there were some roles there too that came up later during my career where that was useful as well. Maybe part of my misfortune became a benefit to me in some ways, in that my program director left in the first month of my program. So I actually had graduated responsibilities as a fellow, where I was covering the men's football team and traveling with men's basketball and other high profile sports. I really felt like the program was excellent, run by Rod Walters, the head athletic trainer there at USC. But I think the fellowship was most valuable for teaching me the politics of sports medicine rather than the content of sports medicine, if you will. You can really self-teach a lot of the content, but it was really kind of how you manage those relationships with the coaches and administration and amongst physicians that I felt the fellowship was most valuable to me for. And then after fellowship, there really was no job description out there that met what I wanted. So I really just kind of cold called or solicited about 20 academic programs and wrote to the chairman of the department and said, this is, you know, I kind of laid out what I envisioned in terms of my career, and what I wanted to do is be involved with both, to be involved with emergency medicine and sports medicine. And I had, you know, I essentially, as a result of that, I ended up at the University of Michigan, who was very interested in developing a niche in sports medicine within their academic program. And I ended up with a joint position between emergency medicine and orthopedic sports medicine. While I was at Michigan, I had clinic 2 days a week. I worked 6 shifts a month in the emergency department. And I got involved in teaching in the primary care sports medicine fellowship program and started some electives for residents and students. And eventually we were able to secure funding for a second position to allow emergency medicine grads to apply. And there are several members of AMSSM who have completed that fellowship track and are now my colleagues. So I'm very proud of that. I think the biggest career-changing opportunity came at Michigan early on when I was offered the opportunity to be a team physician with USA Hockey. At the time, it seemed that none of the surgeons in the group wanted to work with the national team program, which was a development program for high school students to develop a pipeline. It's for it, you know, essentially for the U.S. Olympic team, and try to make the U.S. Become more successful at the Olympic level and international level. And, you know, through the years there, I've taken care of many, you know, stars who, you know, athletes who started at the NTDP and have become very successful professionally. And it's really rewarding, I find, to see all these athletes in their development years become successful. And, you know, you kind of feel like they all become your children at some point, that you are, you know, part of that success and helping them medically along the way. The USA Hockey opportunity, one door kind of opened another in many ways, similar to what was said before. My time with the NTDP in Ann Arbor led to a relationship with USA Hockey, where they asked me to work with the women's team in the 2009 year leading up to and during the 2010 Olympic Games. So that was a career highlight to be able to work the Olympic Games. And then later, connections through USA Hockey led to my job with the Chicago Wolves, because one of the coaches there had previously coached at the Wolves and kind of set up the introduction and the connection there. And then after my time at the University of Michigan, I was a team physician at the collegiate level at the University of California, Berkeley. And after that, I moved on to private practice emergency medicine. And now I'm at Loyola, where I practice 100% clinically emergency medicine and continue to work as a team physician with the Chicago Wolves. So I've kind of done different roles. And I think that's maybe something that is nice about emergency medicine and sports medicine as a combination, is that you can kind of hold a variety of different roles during your career, and it can change during your career. And, it's something that I've enjoyed the different hats that I've worn over time. And kind of like most people in emergency medicine, you have this almost like ADHD that you always have, you want to change and have different things going on all the time. And so it's a field where you can do that.
That was a great introduction. Thank you very much, Dr. Holsheen. And to kind of springboard off of that, we're just going to open up ask some questions, and any of the panelists can kind of discuss what they would like answers for that question. But so I think one of the coolest things for emergency medicine is kind of the flexibility you get with it. And I don't think a lot of students really think emergency medicine into sports medicine. Like you were saying, Dr. Waterbrook, I think it's a smaller niche, both in emergency medicine and in sports medicine. So kind of run me through some of your thoughts when you were like a medical student, like how you thought getting into residency in emergency medicine was going to take you into where you wanted to be in sports medicine. And I think Dr. Waterbrook and Dr. Holsheen, you kind of covered that pretty well in your introduction. So maybe the other three, kind of your thoughts when you were like a medical student, kind of where you wanted your career to go in emergency medicine, sports medicine.
I'll go. I think I'm probably the closest to medical school out of the panelists right now, for better or for worse. But yeah, honestly, I was solely focused on getting into residency in medical school. I feel like it can sometimes seem like a light year away going into residency, much less fellowship. And I do know that, with family medicine, some people would solely pick family medicine specifically just to go into sports medicine. I would say, on the contrary, I find that a majority of my colleagues and myself in particular, when I picked emergency medicine, it was because I enjoyed the wide variety of things that you could do with emergency medicine. And sports medicine kind of helps to augment that, and it helps to kind of make that so much more interesting. Because you have the ability to kind of step outside the emergency department and into a clinic where patients aren't necessarily angry or sad. They're mostly happy and they want to get better, and you have the means and resources to do that. And I think when I was in medical school in Pittsburgh, I had the opportunity to do a sports medicine rotation. I think that's when the light bulb went off for me. Seeing kind of all that in action, I just so happened to want to go into emergency medicine, and knowing that there was a sports medicine route, just knowing that alone was enough. And obviously you can never start too early with your thoughts of wanting to apply to a sports medicine fellowship. But my main piece of advice would be to focus on your fundamentals, really make sure that emergency medicine is the right specialty that you want to go into, because so many of us are doing emergency medicine and we love it. And so it's something that I feel pretty strongly about. You want to have passion for both the specialties that you're in, not just the one that you're kind of aiming for. And so that's kind of my advice on that.
Yeah, thank you, Dr. Dent.
I think our group is, you know, pretty small with regards to EM sports across the country. And like you said, Will, you know, you'll definitely find that, you know, the overwhelming majority of people that are practicing right now want to maintain a practice in emergency medicine. They don't want to give that up. Whereas, like, you know, a lot of my colleagues from like internal medicine, pediatrics, the family medicine world, you know, they might give up their primary specialty and focus on a, you know, 100% sports medicine practice, where I think we like to enjoy the balance of the work. You know, I love the emergency department because you can, you know, go to a shift like, you know, overnight, or you can, you know, work an afternoon or something, or, you know, you might be working your holiday, and it's, you know, just kind of what you do. But on the flip side, you know, we don't have that, you know, we don't have the call shifts, you know, where you're, you know, doing like Q3, Q4 call, or where you're, you know, in the hospital for like endless amounts of hours. You know, sports medicine clinic is really manageable. You know, it's like, you know, a day, you know, 7 a.m. to 3 p.m. or, you know, 8 to 4 or something like that. And the same thing with the emergency medicine shifts. Like, you know, you can work really hard when you're there, which I love. And then when you're off, so you can be home. You can, you know, see your kids, you know, read to them at night, put them to bed. You can, you know, spend time with your spouse, you know, go for a mountain bike ride, or, you know, enjoy whatever hobbies you can. So I think, you know, the people that are drawn to emergency medicine, you know, sports medicine is a kind of a nice offshoot, especially to give you the balance where you can, you know, have a pleasant relationship with patients in the sports medicine clinic, like you had commented on. You can help them get back to their sport, or get back to work, or whatever it is that they're trying to focus on, versus like the emergency department, which can be sometimes like a hostile work environment where you're dealing with, like, you know, challenging patients, and you have like a front row seat to sometimes like the worst of humanity, and that can be kind of draining. And then you can go and, you know, see some patients in the sports medicine clinic, or you can, you know, cover a game, or, you know, go to training room or something like that, and, you know, feel really good about the work that you're doing without, you know, sometimes feeling so defeated like you do after you've delivered like a devastating diagnosis to a patient, or, you know, delivering end of life care, or, you know, something of that nature.
Yeah, I would echo that. I think that that combination really was probably some of the most satisfying years in terms of career for me. You know, that balance between the two, where, you know, the high stress, high acuity ED environment to a little bit slower clinic environment with motivated patients. Sometimes it is hard to, you know, take down the walls from all that high stress environment when you go to the clinic setting and maintain the right kind of empathy and so on. But, you know, from a career perspective, I think it's probably, you know, a really good balance, because the emergency medicine side gives you a lot of tools that will help you in your sports medicine career, and also the flexibility to do things with sports medicine that you like, you know, in terms of being able to rearrange your schedule, you know, stack up your shifts and have time to go on a trip with a team, or, you know, travel internationally, or do other special events.
And actually, one other thing I want to add, especially for the medical students on the call, is that regardless of you know, you can do sports medicine from several different specialties. So you could do emergency medicine, family medicine, which is definitely the most popular, but pediatrics, internal medicine, PM&R. But I mean, while some people only practice sports medicine, the vast majority practice some, at least 50%, in their primary specialty. So I think it's really important, like some others have said, is that you know, whichever path you choose, is that you should love your primary specialty first, and you should train and get really good at that, and then, you know, certainly go on to your secondary specialty, and then be good at that as well. But I think choosing a primary specialty that you enjoy and love, and that suits you, is super important as you go on this journey.
That's great advice. Thank you. Dr. Durkin, do you have anything to say about, I guess, maybe where your thoughts were, like, in your head when you were choosing between residencies, and did you foresee yourself becoming an emergency medicine, sports medicine physician?
Not at all. Not not as a medical student. I came into med school with an EMS background, and I was 100% EM. There was like, maybe a 3-hour period where anesthesia was considered and then decided to be too boring. Interventional cardiology also got like about 20 minutes of consideration, but yeah, it was EM all the way. I mean, I was like the EMIC president, 100%. And so it really wasn't something I really looked at until I had been out in community practice for several years, and then trying to say, what else do I want to do with my career? And kind of just wanting to diversify a little bit. Thought about EMS, but had been really involved in that, through my hospital, and just dealing with like meetings and the fire department union and things like that. And it just didn't, the clinical work in the field is interesting, but the day-to-day admin of like being a big system EMS director did not really excite me. And so, but, getting involved with, I had experiences of like race medicine and, kind of tied into some of the stuff I was doing with some of the search and rescue, mountain rescue stuff. Mm-hmm. And that was pretty interesting. And then kind of looking at the primary care or the kind of more long-term aspects of that. And as it's already been kind of alluded to, but really, I mean, there's a lot of subspecialty options for us. Some of those are accredited, some of those are not. But in terms of, if you want to have something that like, hey, I have a boarding that allows me to have an office practice away from the emergency department, as far as I can tell, this is the option. And it's super interesting work. And there's an opportunity to kind of understand sort of more of the whole spectrum of care, not just what goes on in the ER. So yeah.
So I have another question for our residents out there that are trying to kind of set themselves apart for a sports medicine fellowship in the future, and kind of in this pandemic world, how do you kind of see a emergency medicine resident currently being able to stand out to a sports medicine fellowship?
Yeah, emergency medicine residents are really just by nature already pretty competitive, which I think gives them an advantage. We did some research about 2 years ago, and we had published a poster at AMSSM this year just talking about some of the characteristics of emergency medicine applicants to sports medicine fellowship, and we were able to show that emergency medicine residents were pretty competitive overall, and had a lot of the features that programs are already looking for, like great academic qualifications, like a solid research background, great ultrasound skills. So those are things that kind of shine. I think where it's difficult for some of our residents sometimes is that the number of programs is fewer for them to apply to, so there's not as many spots across the U.S. So you kind of have to do your homework to find out which programs are probably going to be a good fit for someone with an emergency medicine background. Because while there's a tremendous amount of awesome sports medicine programs out there, not all of them are going to be such a good fit for somebody coming from an emergency medicine background, just because you still have to practice in your primary specialty, and you want to have probably some like-minded faculty in your program. And number one, you just want to make sure that they can accept somebody in an emergency medicine spot. So those are all kinds of things to think of that could make you stand out a little bit.
I might piggyback a little bit on that. I feel like when I came through that, it was a little bit of trial and error, having to interview at a lot of places to figure that out, apply to a lot of places and interview at a lot of places. Since then, our emergency medicine groups and sports medicine groups within emergency medicine organizations have put together some of those lists. So, if there's any students that are watching this or interested, I would encourage you to check out some of those websites or contact the officers to see the legwork that's been done. But we do, have compiled a list of family medicine programs that accept EM applicants, as well as there are some programs outside of the match, and then there's some in the match that are EM run and sponsored positions. And a lot of that changes over time depending on where the funding from the fellowship's coming from. So just because historically in the past it may or may not have been an option, things do change. So ultimately, you have to like Christopher said, do some of the legwork yourself. But you know, I think, you know, reach out if you're interested, and those are discussions that can be had with those who have gone through the process.
Yeah, I'll add on to that. I think from an emergency medicine resident standpoint, you might be in a location where just because so many of us, there's so few of us across the country, that you might not find emergency medicine, sports medicine mentor at your institution per se, or you might find that you don't have the correct sports medicine experiences already set up for you at your residency. It doesn't mean that you can't actually get that going for yourself. I can speak that from personal experience. The residency I came from didn't really have a sports medicine program at that institution, but the neighboring institution did. So I was able to kind of set up my own electives, my own rotations, which kind of not only demonstrates your interest to on your application, but also kind of helps to further stimulate your own interest in the field, and kind of you'll be able to kind of determine whether or not you actually have an interest in that field in sports medicine. And so I would say that just because you don't have an emergency medicine, sports medicine mentor there, or a curriculum already established, it doesn't mean that you can't do it yourself. It doesn't mean that you can't find a mentor through national organizations like AMSSM. It's all right there within your reach. And I would say that with regards to COVID, if anything, it's kind of enhanced our online accessibility. We're living proof of that right now. We're on Zoom doing this. And so, you know, I would say one of my interests is online education. And so, you know, if you're a resident interested in getting involved in sports medicine during COVID, online education is one of the things that is readily accessible in terms of projects, in terms of writing up a simple abstract to submit to AMSSM. I think the deadline's tomorrow, but it's fine. You know, there's a lot of opportunities. Just because there's COVID, it doesn't mean that you can't actually get yourself involved. And I'm sure everyone on the panel is more than happy to talk to you about that in terms of what sort of experiences you can gather from that. And I think I see a couple of people here who are actually involved in online education over here. So I think there's plenty of opportunities to be had.
Yeah, I would just add to that. I mean, coming into this from a, you know, community practice where I wasn't linked into rotations or anything like that, you know, it's an opportunity to be a self-starter and just look for, you know, do I know someone in orthopedics that I can do some rotation with? You know, it's a pretty low bar to get involved with, like covering some high school sports games. Particularly football is a good one just because people get injured when they play football. You know, races that your department might help cover, anything like that, you know, any of that may or may not be on hold with COVID, depending on where you are, but just seeking out, you know, demonstrating some initiative to get some exposure, both, you know, in the sideline as well as in clinic. But yeah, just, it's not hard. You just got to talk to people.
Thank you, guys. So kind of what I was hearing while you guys were going through your introductions is that sports medicine and like having that clinic life kind of stabilizes like your overall life, like with having being able to stack up your rotations and stuff like that to make room for sports trips and things. So what do you think the kind of ideal balance is in your life between emergency medicine and sports medicine, finding that ER life and that clinic life?
Well, I've had different hats at different times in my career, and I guess I'd say that at the time that I was in them, that I felt like that was the best balance. But you know, I really like the 50-50 split in general. You're not, you know, at most maybe you're doing one night shift a month, so the whole sleep cycle issue is not as much of a factor. You know, there's times, you know, like now that I'm 100% EM, and I like it being that way for now. I mean, I've chosen to be 100% emergency medicine because of the stage I'm at in my life. So, I mean, I think it kind of depends what your goals are, but I do think that early on, there's a lot more learning to be done after fellowship. And I feel like being in that environment with an appointment under orthopedic surgery really helped me learn a tremendous amount more over the first few years of my career. And being in that environment where I could consult a surgeon and an expert on a daily basis during my clinic was really helpful for my knowledge, which then translated to patient care. And it also opened up a lot of doors early on in the career that I wouldn't have had otherwise, because, the way things exist now, many athletic team affiliations are run through sports medicine groups, the majority of which are run by orthopedic surgery. And I feel like if I were just running, if I had a shingle that I, nailed to the door and opened my own clinic right off the bat, it probably would have been a little bit harder for me to get access to some of the opportunities that I had by being part of an existing group.
I don't know that there's ever any sort of ideal balance, whether it's EM versus sports medicine, whether it's, home versus professional life, I feel like there's just sort of an ebb and flow in life. And I mean, it's kind of what Jolie is talking about in a different way. I think things change over time based upon so many different circumstances and opportunities, et cetera. But over time, you sort of figure that out. And I think that that's something that sports medicine gives you as a subspecialty. It gives you another way to practice medicine. And so, that ebb and flow will change over time. And I think, like I said, for different people that will look different, but it will also, even for one person, that will look different over the course of their career. And the cool thing about it is that you have the opportunity to do that. If you don't subspecialize, I mean, you don't even have the option. And this kind of answers the question a bit. There was a question in the chat about professional burnout, and I know for me, 100% having two subspecialties has been key to not getting burnt out, both ways, to be honest with you. I kind of said in my introduction, I don't think that I would be happy doing 100% of either specialty, at least not at this point in my life. And having the two, I feel like they really enhance each other professionally. And I really, really appreciate that. And like I said, I feel very lucky because I don't think I understood that when I was doing a fellowship, but now I think having the two different practices really helps stave off burnout, especially in the days of COVID.
Yeah, thank you for bringing that up, Dr. Waterbrook. That was one of the questions that popped up in our chat dialogue, was just the research on EM and burnout and how sports medicine kind of mitigates some of that professional burnout. So I don't know if Dr. Den or Guy or Durkin want to also explain on that.
Yeah, there's no question about it. I think that, having subspecialization in emergency medicine really gives you the flexibility to kind of scale your practice depending on what your interests are, and to really avoid burnout. In my emergency medicine career, I don't feel like I'll ever want to kind of hang up my stethoscope and no longer practice emergency medicine. I know some of my colleagues who are just practicing straight emergency medicine, they might feel a little bit differently. They're looking at early retirement options like that. But I think having this type of subspecialty training really allows you to be energized and take advantage of these opportunities to see patients in different types of settings and still feel engaged in the work that you do.
Yeah, definitely. Would just add on to Chris and just say that there's no question, again, that sports medicine definitely prevents burnout. I think not just because I practice both emergency medicine and sports medicine, but because I think what Anna had mentioned before is you just have the ability to go beyond emergency medicine. I think it's kind of like that light at the end of the tunnel, and saying that if you are experiencing burnout in your emergency medicine practice, you at the very least know that you have other options beyond just emergency medicine. You have the capability, you have the skills and the training to go beyond emergency medicine. And it doesn't have to be clinic. It could be team coverage, it could be event coverage. Just having both emergency medicine and sports medicine after your name kind of really expands the possibilities that you have to kind of buy out of the emergency department burnout, essentially. And so I think I'm super happy. I don't know.
The other thing is that I think it gives you like a real niche, right? So even if you practice emergency medicine 100% of the time, we're sort of jacks of all trades, but experts at none. And by having specialty training, you're sort of like, this is your area of expertise. People in the ED will come to you, other attendings like, hey, I've got X, Y, or Z. What would you do with this? What would you do with that, et cetera. And so you really have sort of this niche of expertise, which I think is also super helpful.
Very cool.
I also wanted to bring up that I think that being an emergency medicine physician in sports medicine really there's a big need for and more opportunities coming along all the time. I think for those with that background with the mixture of both EM and sports medicine. So many collegiate teams and pro teams now are looking for emergency physicians to complement what they do, but some of that is actually mandated by, medical guidelines. For example, in the NHL and the NFL, they mandate having an emergency physician there on the sideline in their medical handbooks, and that was, spearheaded by several emergency physicians who were involved in those leagues over the last few decades, and so. I think that, there are some special opportunities for us since the numbers are fewer. There's probably more of us that percentage wise that will have access to be involved in some of those things.
Very cool. Good point. So we're coming up on our last 10 minutes or so of discussion, and I was just going to put it out there if anyone had some anything they wanted to say in particular. Otherwise, we could maybe explain your one shining moment in emergency medicine, sports medicine, kind of like where the two, like an example of a story where the two kind of fields just overlap perfectly for a case.
I think it happens every day that I work a shift clinically. You've got people like these guys are saying, you have like everybody in the department coming up and saying, oh, hey, can you show me this on ultrasound, or can you help with this procedure? We've got this, reduction, or, we have this joint aspiration, or, some type of procedure that they want to get you involved in. You're also like the go-to guy for DME because durable medical equipment, because you're the only person in the emergency department that knows how to put on a T-ROM brace or, Sarmiento brace or, something else, and everybody else is like looking at it like, it's got 100 straps. Like, what does this do? Like, how does this thing even work? So, while some people are like, experts in critical care, you're talking to them about sepsis management, things like that. Like you get to do some pretty cool cases, helping to manage the anxious high school student who's, coming in with concussion, or, the 75-year-old coming in with symptomatic arthritis, and you can do a joint injection in the emergency department, and all your colleagues think you're amazing because that patient was able to walk out of the emergency department. Whereas you didn't have to send them home with a prescription for narcotics or something like that.
Dr. Durkin, you're in wilderness medicine as well, right?
Yeah. I work with the search and rescue team here in La Plata County, Colorado. So
have you ever done any wilderness medicine, sports medicine, kayaking challenges and things like that?
Not like you're talking about the adventure race stuff.
Yeah.
I've not done that. I've certainly put in shoulders on the side of a mountain, in the back of an ambulance, in the back of the ski resort, in the ski resort parking lot, in the mountain bike. It comes up for sure. And if you think about wilderness medicine, most of the injuries are actually sports injuries. They're athletic people. They can't, someone who's not athletic can't sort of by definition get to the wilderness. So so it comes up a lot. There's a lot of crossover there, and it's definitely interesting stuff. So.
Very cool.
I think it's pretty cool that kind of what we've all been talking about is emergency medicine and sports medicine. You kind of fit a niche in kind of both specialties. And so not only in the emergency department are you the one that everyone just sees MSK and they just immediately go to you afterwards. They're like, what do I do about this knee? And you're like, you know what to do with the knee. Like there isn't anything special, but they somehow think that you have extra special powers that somehow make the knee better. But also in sports medicine, kind of like when you're on the sideline or, you know, at ski clinic or even at a game, if something emergent happens and you're the only one not freaking out, it's because you have your emergency medicine training and you're like, they're fine. They're still breathing. They've got a pulse. It's going to be just fine. But everyone's like, they could be dying, you know? And so having that kind of ability to kind of triage the situation in a sports medicine setting, I think is rather satisfying.
Yeah, absolutely. I think, you know, we've talked a lot about sort of how your expertise can be used in the emergency department, but I think like Will was referring to also on the sidelines in particular, when there's an emergency situation. I mean, even as a fellow, my family medicine, sports medicine colleagues were like, hey, Anna, I was the first EM sports fellow here. And they'd be like, hey, what do I do about this? I mean, one of our cases actually was during a football game, the away team, the quarterback got hit. And after the game was complaining of some chest pain. We ended up taking him to the ED, and the chest x-ray looked fine, but a couple was like, oh, I don't know, maybe there's pneumo, maybe there's not. We actually busted out the ultrasound and there was no lung sliding, and he got a CT, and, you know, he did end up having a small pneumo. And, you know, you're talking about how these two subspecialties collide. I feel like, you know, there's the expertise in the emergency department, but there's also the expertise on the sideline and helping to manage. I mean, while the true emergencies are rare on the sideline, they absolutely happen. And as emergency medicine providers, we are much more comfortable and sort of adept at managing them. I mean, our primary care colleagues are oftentimes much more adept at managing, you know, the chronic medical illnesses. But it's one of the beauties of, you know, primary care sports medicine. It's really multidisciplinary, and there's lots of different primary specialties involved. And I think it's one of the many great things about it.
Definitely, thank you.
I think that sorry, go ahead.
I was going to say, Dr. Holsheen, did you?
Yeah. You know, it's really rewarding to be able to recognize things immediately when they happen, you know, whether it's injury patterns or whatnot. I mean, I think it really, that level of expertise, thinking quickly on your feet and recognizing, you know, these serious medical conditions. You know, I've, over the career that I've had, I've seen everything from, you know, pneumothoraces to, you know, to renal lacerations, Lefort fractures. But, you know, some of the unique things that are, you know, equally interesting, I think, is traveling to, you know, another country, you know, with a team, and you're you know, the buck stops there. There's not good medical care around. The parents aren't there. You know, you're the one there that's, you know, the lifeline, if you will, for the athletes and the coaches and the athletic trainers. And, you know, those experiences traveling with the team and developing the relationships with all of those, you know, folks, athletic trainers, coaches, and athletes really is what makes it a rewarding career. And I think as an emergency physician, you have a great skill set to bring to the table to help them medically.
Very cool, thank you. And I think we have one last question from David. And he said, thank you so much for doing this. And I want to reiterate that statement. Dr. Den, Dr. Geyer, Dr. Westbrook, Dr. Holsheen, Dr. Durkin, you guys have been all great in creating discussion tonight. But what he was asking was, is there a difference in compensation in regards to splitting your time between emergency medicine and the clinical world?
I'll go for what I'll be doing with IHS. You know, I'm a GS-15 band 2 with a location differential. It's hourly for the government, so whatever I'm doing for them, it's all the same.
Okay.
I think there's a lot of geographical differences, like in practice types. So if you're in an area where there's like high demand for emergency medicine, like the compensation is going to be pretty high, especially in like some rural areas or underserved areas. Where if you're practicing like straight emergency medicine, you know, the compensation is going to be a lot higher And a lot of the, I think a lot of the urban areas are like, more competitive markets for emergency medicine. Like I'd say it's probably like a little bit more evenly split. That's what I've seen in a lot of like different practice types. If you're looking more like at an academic institution, actually probably like working in emergency medicine and sports medicine at the end of the day is probably like a similar type of compensation package. The nice thing about practicing emergency medicine is like you could always kind of scale up and pick up like extra shifts or pick up extra work kind of on the side.
Thank you very much. And we got one last question that squeaked in here, and that was concerning the major training differences between EM-based sports medicine fellowship versus a family-based sports medicine fellowship. So I'm sure when you guys got to your fellowship programs, there were other fellows that were with you, and kind of how did you see your skill set compared to theirs coming from the emergency medicine world, like your strengths and weaknesses compared to family medicine?
Well, I guess one thing I would say to answer the question is that if in terms of an emergency medicine run fellowship program versus a family medicine run fellowship program, the content should in large part be the same. I mean, they're all, if it's an accredited program, we're essentially taking the same board certification test at the end of the day, no matter which program you graduate from. The differences would be that as an emergency physician, during your 4 hours a week of required time in your primary specialty, you need to spend that in the emergency department instead of clinic, like an internist or a family physician or a pediatrician would. So that's probably the part that becomes a little bit difficult in a program that never had an EM grad before is figuring out where that experience is going to be. But I think, as far as the skill set, I mean, what you come with from residency does, you're able to do certain things or run codes and, in a different way, I guess, or your experience definitely is at a different level for certain situations. But then the contrary for family medicine in terms of, primary care type clinical scenarios as well.
Yeah, definitely. I think like emergency medicine versus family medicine, the biggest difference I would say if you were to look at EM-based versus family-based is whether or not you have a built-in rotation for your clinical competency. So for the 8 hours or whatever that you have to work per week, 4 hours per week that you have to work, it ends up being about a shift a week or so typically. That if that's already instituted, it's because chances are they already have a strong emergency medicine understanding. It doesn't have to necessarily just be EM based. I would say that I trained at a program that was PM&R based, but they already had an established thing set aside for me. I worked every Wednesday at 9 a.m. In the emergency department. And so for me, I really enjoyed having the multi-specialty component, seeing PM&R, seeing FM, seeing all the different, all my co-fellows from different specialties come in with so many different types of strengths and weaknesses that ended up kind of balancing itself out at the end of the year. And so I don't think that there is a huge difference between the two, as long as you have kind of an established role for you as an emergency medicine physician, like you're functioning as an attending, for example, to continue your practice in that fellowship.
Yeah, I agree with Will and Jolie. I would just also sort of emphasize, I think what's really important about it is that you are able to practice emergency medicine as a fellow, especially if you're a new resident. We are a very procedurally heavy field, and we need to think quickly on our feet. And I just worry, and I have no data to support this, to be honest with you, but I just would really worry that your emergency medicine skills would atrophy if you're not able to practice them for that, especially that first year right out of training. I remember when I did my fellowship, you know, by December of that year, I felt much less confident as an attending in the ED than most of my colleagues who had graduated at the same time of me in emergency medicine. But I also realized that they had literally worked more shifts in the first month out of training than I had in the last 6 months. And so one of my analogies is it's sort of like a toddler who's learning 2 languages at one point. Like they might be a little bit behind in the beginning, but ultimately they're fluent in both. And I think that that's what happens for us in emergency medicine. And so I don't think that you would want to go to a program that puts you, for example, in an urgent care clinic all year. I think it's, you know, ideally you're able to work in the emergency department as an attending. But if not, at least as a resident where you're practicing your emergency medicine skills so that they don't atrophy after that year. Because I think, well, it's a risk because you're working less shifts. I mean, I've been doing this long enough that everybody is fine. I mean, you're still practicing medicine. You're still in the emergency department. I don't think it's anything to be concerned about, but I do think that continuing to practice emergency medicine is really important. There are a few emergency physicians that I know that have not gone to an emergency medicine based fellowship. And I feel like the majority, well, certainly not all, but the majority are people that kind of wanted out of emergency medicine. That's not what they really wanted to do. But I think if emergency medicine is what you really want to do with sports medicine, having a place that you know lets you practice emergency medicine is really important. And I think the other thing is I remember I was the first EM sports medicine fellow here, and it's sort of nice to have, at that point there was no EM folks, and while they were supportive of me being there, they sort of didn't get me and my terminology. And, you know, I would be still asked like when I was going to my continuity clinic. I'm like, I'm not working in a continuity clinic. I'm going to the ED, you know, like there were just certain things like in my fellowship program director at the time. I mean, he was a great guy and it meant well, but he had no idea what it meant to like work a 5 p.m. to 2 a.m. shift. And I was, you know, he'd make me work up until right when I would go into my shift. And I'm like, oh, you know, I don't want to be a whiner, but this is just, I need a break. Anyway, I think it's also nice to have people that sort of get you and look like you, so to speak.
I had a little different experience. I actually did my fellowship at a family medicine based program, and they were pretty accommodating. I mean, I hooked up with the emergency medicine residency that was based out of the same affiliated hospital, and I essentially worked almost like a junior faculty member there, somewhat independent, but you know, they're still officially reviewing the cases. So I think it depends. You know, you just need to inquire what the opportunities are. But by definition, if you're going to graduate from an accredited program, they have to offer you that 4 hours per week in your own specialty. And if they, you know, if they can't provide that, then I guess you can't go there. But you know, that is something that is a requirement.
And I think we're going to about wrap this up. But Dr. Den, Dr. Guy, Dr. Durkin, any last minute advice before we kind of wrap up discussions on future physicians' careers?
Get involved. Come see us at AMSSM. Hopefully we'll be back in person in the spring, but if not, we'll be there virtually. The emergency medicine interest group is a great place to network and to get to know people and get involved. We have an endless number of projects happening across the country, and there's no better place to get paired up with like a mentor or somebody who can kind of guide you in the right direction, or, you know, even help you to get some projects going that can help to boost your applications as a student or as a resident.
Definitely great for that.
Yeah, don't let COVID get the best of you. You know, I think we're all still smiling on this panel, and it's for a very good reason. You're interested in the right field, you're interested in the right specialty. It's just a matter of taking that next step. And if you're not involved, get involved. If you are involved, continue to be involved, and you'll find that we're a great community. I've loved it so far, and I think I'll continue to love it for the rest of my life.
Awesome, thank you. And Dr. Durkin, last second advice?
I think it's all been said. Good
All
luck.
right.
Be have initiative. I guess if that's our parting thought, have initiative.
Great. And thank you very much, everybody. Definitely a pleasure meeting all of you, being able to talk with all of you. Great discussion tonight. On behalf of everyone from AMSSM, MSIG, thank you very much and happy holidays.
Happy holidays, guys.
Thanks,
Take
everybody.
care. Aloha.
Yeah. Thank you, everybody.